Hi, everyone. Thank you, everyone, for joining and giving your time for this wonderful session. I'll try my best to answer all your questions and help you out. So, a little bit about myself. Basically, I was a practicing dermatologist in India. I completed my graduation in 2016 and then postgraduate training in 2019. Because of family ties, we decided to move to United States, and me and my husband, we both couples matched into a community program in Ohio. And I'm also a mom, new mom. I had a baby during my intern year, and my husband matched into nephrology fellowship at University of Florida in Gainesville, that's North Central Florida. And I'll be joining there as a hospitalist and also assistant professor of internal medicine. So I love mentoring, and I've been helping out, USMLE candidates all around the world through my Instagram page, that is USMLE Derma to IM, as well as I've also shared my journey on my YouTube channel named Prachi Gajjar USMD. So I'm happy to answer all your questions and, from my experience and as far as I know.
All right. Thank you, Dr. Prachi, for your introduction. So I'll just tell you guys the general layout of this webinar. We'll be going with the pre-registration form questions first. And meanwhile, if you guys get any doubt, you can keep typing them in the chat. And once we are done with the questions that were asked in the form, we'll go over with the questions that are there in the chat. So I think we can get started with our questions, right, Yusra?
Yep, sure.
All
Yes.
right. Okay, Dr. Prach. So somebody asks, what is the ideal timeline?
So I would say that we are allowed to upload 4 LORs. So personally, I had uploaded all 4 US LORs. I did not use any home country LOR. So that's what I would recommend, that, minimum 3 to 4 United States clinical rotation, that would help. And even I had done 3.5 months of USC, but I was able to grab 4 LOR for my 3 months of rotation, and I'd uploaded all 4 US LORs, and it really helped. And at the same time, it's also important to upload a strong LOR, not a generic one. It does make a difference. People do read your LORs, they talk about it if they've written it very nicely. So it's always better to ask your attending to write the LOR instead of you writing it and then the attending just going through it and just signing the paper. And I've also made a video on how to earn a strong LOR, on my YouTube channel, Prachi Gajjar USMD. Do check it out.
All right. Thank you for that answer. So I guess the question also specifically asks that what is the ideal timeline to do that? So how do you suggest
I
that would
had done it.
happen?
I had done it. I mean, I would recommend it. It's better if it is fresh, like within a year of your application. But obviously, if you are doing an elective, it wouldn't be that recent, because electives people break their internship in their home country and then they come. By the time it's possible, your steps are not still done. In that case, if for elective, it doesn't matter. You just have to do it in your internship, and then again remind your attendings to upload the LOR, whenever you are submitting your application. Otherwise, if you have an option, you can do it as recent as possible, like, immediately after completing your step 2 CK and in between your ERAS submission. I had done it from July to September.
All right. So the next question we have is, how will my match chances be affected if I apply for medicine match but currently doing psych residency in my home country?
Uh, so basically, it is switching the specialty which I had done. Like, I was a dermatologist, and here I had applied for internal medicine. So everyone will definitely surely ask you this question, that why are you switching the specialties? And you should be having a convincing answer, not that you just boast around, and it should be basically convincing, and you should be able to justify why you are doing this. It can be as genuine as, that For me, dermatology match is really very competitive in the United States. You have to be either a citizen or you should be having US dermatology research, which I had to give extra 2 to 3 years. Which I was not ready. So you can be frank, you can be genuine. Otherwise, you can give some convincing answer that why you want to do internal medicine. And they will also question you that are you applying to psych and is internal medicine your second priority or alternative to psych. So you should be able to convince that no, IM is the only specialty I've applied and I'm not at all thought about psych residency here. So if you are keeping IM as a second option, then the program wouldn't like it. They would also keep you, lower in their rank on the list.
Is it possible to match in neurosurgery as an IMG in the next years, even weak programs?
I would say nothing is impossible, but yes, it is difficult. Usually in general surgery, I have not seen that many IMGs as I see in internal medicine. So yeah, but if you have extraordinary scores, if you have very good rotations, like say 6 months, 7 months of USC and really very strong LORs from reputed surgeons, like say university program or highly reputed hospitals, then let's make it. It is possible, and it might also happen that you might not match in the first cycle. You might have to do more rotations, might have to build more contacts. Eventually, after building a strong profile and strong contacts with everyone around, it is possible, but not impossible, I would say.
Our next question is, how can I improve my CV if 3 years have passed since my graduation?
When I had applied, my graduation year was 5 years, like year of graduation, because I had done in between, obviously, dermatology residency. For me, it was 5 years old. But I think not all the programs keep that filter of just 3 years of graduation. Some of the program they keep it 5 years. Some of them they don't keep any filter. They look at the scores. So you can overcome any a weak part in your profile by working hard on the rest of the profile. That is, your step scores, completing your step 3 before submitting the RAS application, or, before December, you complete your step 3. You have good LORs, good rotation. So then you have other things to speak upon, and then obviously, believe it or not, contacts do matter. And there's a thing called recommendation in the US healthcare system where, any attendings or any residents, if they can speak in good words about you, then the program directors, they do pull up your application and they also consider you for interviews. So yeah, make sure to have good relationship, good contacts with all your alumni from your college and, your friends, seniors. That might help.
Yeah, I'll just ask this question too because it's related to the previous question. Can people with 3 red flags, year of graduation 2000?
I would consider that. I mean, as I said, year of graduation is not a problem unless and until your year of graduation is, say, like 10 years old. Then you have to really work very hard on other parts of your profile, like your step scores, LORs, rotations, and contact. But if you have the red flag as an attempt, then yeah, definitely they have a filter of attempt. Most of the programs, I mean, they will filter you out. If you want an interview, then you should be actually doing a rotation in that institute, or someone should be actually recommending you very strong, like, some attending, you have direct contact with the program director, something like that. That might actually help. So yeah, it's possible to match, but it will be a little bit difficult. You just have to give some more time.
I've been employed, but I'm yet to publish any research, which has been difficult to do in my home country without funding. So, any advice on that?
So research, take the note of this point that research is not mandatory to get matched, because not all the programs they are actively into research. Okay, like for example, if you go in a community program where there's not so much of research going on, then it's not a thing to impress them. So it's not mandatory, but if you have done your research, it's always good because if they see research in your profile, one of your interview question will be from research. But if they don't see anything in the profile, then they won't ask it. It's pretty straightforward. It's always better, even if you have not published it, even if you are working on it, or manuscript writing or something, you can still talk about that, in your interviews or even your application. I think you can mention about that. Yeah.
All right. So,
I've been employed, but I'm yet to publish any research, which has been difficult to do in my home country without funding. So, any
Mm.
advice on that?
So research,
of current restriction on immigration on USMLE for IMGs.
uh, IMGs, I mean, personally speaking, from any program standpoint, uh, there is a section of visa requirement, you know, in all the candidates. So you do get extra 25 points up if you're not visa requiring. So all the programs, they do prefer non-visa requiring, like, green card holder or citizen. But it's not always possible that the green card candidate will rank the same program high. So the match is, it goes both the side, right? So everyone wants a green card holder resident, but no, it's not possible always to be highly ranked by those candidates. So sometimes the programs, they do stuck with IMGs and they do require IMGs for the program to be going. For example, where I belong, my community program, we have like around 70 to 80%, we all are immigrants. Our program ranks every year US citizens high, but unfortunately they don't rank our program high. So it goes both the way. So I don't think so it will actually that much affect the match rate. And yeah, if you complete your step 3 scores in time, you can definitely talk about getting H1B visa, you know. See, during the COVID pandemic, like in 2020, 2021 was when I, came here for the rotation. So that time it was very difficult. I had to use agencies, in order to get rotations. Some of the university programs like University of Kentucky, I emailed the cardiology department directly and they replied to me. So just start emailing, reach out to the programs, community programs, university hospital. They might kind of uh, they might reply you back. If not, then agencies are always available. Make sure if you're going through agency, it should be a good rotation. For example, I had done a rotation at Stony Brook Southampton Hospital. It was really very good. Make sure you do externships, like hands-on. University programs, they don't provide you hands-on. University program, it's always an observership, whereas community program might allow you to talk to the patient and examining them, which we call it as externships. Externships are always better. But again, if you're getting an LOR from university and it's observership, it's fine. And I know there's a Larkin hospital in Florida, Miami, which gives you a sub-I, that is a sub-internship, which is really good, where you actually are allowed to talk and examine the patient and kind of LOR also, they'll write it up that you are actually doing a sub-internship. So that would be better, I think.
Does taking step 3 really help for matching for those with low step 2 scores?
Yes, so step 3 is a very important exam. I have made a separate video on step 3 on my YouTube channel. Also, I've made a post on my Instagram as well. Do check it out. So, step 3 is not only important for the one with low scores, but it's also important for the one with high scores. Why? Because there are many benefits. Firstly, if you've done your step 3, then the program can give you H1B. Secondly, the program will rank you high in their rank order list because they don't want you to take leave after joining your residency just for your step 3, preparation and stuff like you can. And second benefit is, as a resident, you are changing the country, you're starting a new life. At that point of time, you don't want to be, busy studying for the exam rather than learning the new hospital setup, the new environment, and new electronic medical record system and stuff. So you'll be busy, because you've changed the country, documentation, paperwork, social security. So a lot of things have to do. So better to get it done before, you know, you start your residency, I would recommend.
For available positions in research?
Start emailing the big universities. I've heard few people getting research position in Mayo Clinic, so they always, if you know someone, some resident in the United States, reach out to them. Some of the institutes, they do ask a reference. Like if you already talked to an attending, and if they are accepting you as a research position, then it will be easy, instead of applying as a newcomer and you don't know anyone in the institute. It will be difficult in that position.
The next question is, can I fill my gap year with volunteership or do I need a job?
A job, I don't think so. You're allowed on a visitor visa. So job you can do if you are a green card holder or citizen. So yeah, I do recommend, if you're a green card holder or a citizen, you're eligible for the job, then a scribe. I mean that actually it does help in making contact and in creating an impression during the interview.
Asking, could you explain how it goes and how is it different from people who apply individually? And can two people who are not spouses of each other, can they also apply for couples match?
Yeah. So yeah, for couples match, I have created a wonderful, a very detailed video again on my YouTube channel, Prachi Gajjar USMLE. Do check it out. But I would say for me, couples match actually worked far, far better compared to if I had applied individually, because I had average score, whereas my spouse, he had a good score. Like my scores were in 240s, my spouse, he scored around 250s in the step 2 CK. So there were some programs. I mean, I personally did not get that many interviews if I had done individual application. Like for example, even through contacts on my own, I was just able to get 2 to 3 interviews. Whereas my husband, on his own, without any contact, he received 3 to 4 interviews, and he talked to them during the interview that, hey, can you, uh, do you mind if you, like kind of go through my spouse application if she's eligible for the interview? And all of them, they agreed to it. They reviewed my application, and actually I got an interview. So at the end, we both had, say, 8 interviews, of which 7 were in common. So for us, it actually worked in favor, compared to those who had applied individually.
The next one is, what can one do if they have a step one attempt, how to overcome it, and what do you say during the interview when asked?
So step one attempt, I mean, yeah, everyone will notice that you have an attempt, and to overcome that, you should. I already mentioned earlier, you should work on the rest of your profile, like your step two scores, step three, doing rotations in the residency program, and asking your seniors or some attendings to recommend you. That's how they will basically, include your application out of that filter which that set. So yeah, it's possible. If they ask you in the interview, even if they don't ask you, I would still recommend you to, you know, talk about it, that uh, should be able to justify why you had an attempt, basically. Like, were you overconfident, or did you have any personal reason to have an attempt, or what was it? Were you in a rush, or, whatever personal reason you have. But at
Okay.
the end, you also mention that what you learned from that experience, and how you used new techniques or new learning method to overcome that low confidence in your step 2 and step 3.
Is it possible to match into a university program with a step one attempt?
It is difficult, I would say, because even in community program, they do have a filter of attempt or not. But again, it's not impossible. As I said, with attempts, you can definitely showcase your work through other parts of your profile, rotating there in the university program. If you know someone from the program who can put in good words for you, it depends. If a resident is putting in good words for you compared to an attending saying good words, or compared if you directly know the program director himself, then does make a difference, you know.
Is from Joyce. What factors should one consider while making rank order list?
There are multiple factors that you should be thinking of while making the ROL. I've made a post on my Instagram page, that's USMLE Dum 2 IM, to check it out. There's a hierarchy I would go. It again depends on your life goal. If you want to do a fellowship in future, like competitive fellowships in internal medicine, like say cardiology, GI, hemonc, rheumatology, those four, I would say that you should be going in for a J1 visa. It's easy to get more number of interviews. And if you have a university program, you can rank that top because most of them they do have in-house fellowships. You can check which in-house fellowships they have. If not university, then second I would go is community program with in-house fellowship, depending on your life goal. If your goal in the future is just to become a PCP or a hospitalist and not to do fellowship, then obviously you can put the H1B programs on the top most. Okay, like less competitive fellowships like say nephrology, ID, endocrine, you don't require J1. It's also possible to match with H1B. Obviously, if you don't have any such program, you only have J1 programs left, then decide based on your personal reasons, say like your family ties there nearby, or location, affordability, accessibility. Is that program allowing an away rotation or not? That's also important. And what is the schedule like, the work-life balance in that specific program? Then you should be looking at other aspects as well. Okay.
So says I have a score of 227 and my partner has a score of 248, both recent year of graduates with similar research. If we apply for couples match rather than individual, are there any cons to it? Will it affect any of us negatively?
No, so as I shared my experience, I don't know if you heard about it, but also go to my YouTube video on my channel. So it will benefit you more than him because he has a good score. You have an average score just like me. So he will get more number of interviews. He can talk about you during the interview, and that's how they will review and consider your application also for the interview. So yeah, it's a win-win situation. There's no disadvantage, but only advantages I felt. Yeah. And believe me, in the US, family tie is a thing. Like most of the programs, they do ask you, there's a separate section for family ties. So if you say in your interview that, hey, my husband already interviewed in this program and he's gonna rank this program very high, this is the only common program we both have, then it's they will write it down that you are gonna rank this program in the top. Means that you are gonna rank this program high. So they would like to know it and they will also note it down. Okay. And I missed answering one question earlier. Couples match, anyone can do it. Any two friends, two cousins, relatives, anyone basically can couples, and doesn't matter. They don't ask that. It's basically just a family tie you have to mention. And couples can also apply from two different specialties. Like for example, I'm interviewing in IM. I can request my program director to talk to the family medicine program director if he has good terms or if he has that relationship. If they are friends or if they do consider each other's recommendation, then yeah, it's an advantage.
During eras or NRMP?
I mean, you have to do it in both the ways. You have to take the token in NRMP, and then coming to your ERAS application, there's one question where are you going to do couples match, and they ask you your spouse is AMC ID as well. So yeah, in both the application you have to apply for couples. And at the same time, personally, I had applied individually, but later on in January or December, that's when we actually bought the token and we changed our IRAS application status to couples. And in February during the ROL, we used that opportunity to inform all the programs that, hey, we are doing couples, make sure that you rank me and my spouse higher in the rank order list. That's also important in couples match. I've explained it in detail. So even in rank order list, for you both to get matched in the same program, you should be requesting the program to rank you both kind of nearby. Like if they rank you at number 20, your spouse should be at least in 25 or say 30. If you are number 5 and your spouse is in number 50 or number 30, then there are less chances that you both might not match in the same program, you know.
In ROL, if we put match and no match, that means only one partner will match, right? If he is ranked only by program.
So couples match ROL that goes differently. Check my post on ROL on my Instagram page about that couples match. So you make combinations. For example, I had 8 interviews. My husband had eight. So eights are 64, I think. And on top of that, his no match, my no match, his match. So it went to total, say, around 81 combinations for us. So yeah, you have to put all the combinations in your couples ROL, like all the combinations, including your no match as well. It's upon you who is ready to go no match first and who is ready to take the match first. Okay. Yeah. Do check out that video. It will help you a lot in making the combination.
All right. I guess we don't have any other questions. Guys, I'm gonna give it a minute. If you have any questions, just quickly type them in the chat. And for any other doubts, you can go to Dr. Prachi's YouTube channel. It's Dr. Prachi
Prachi
Gajjar,
USMLE.
USMD, right?
And my Instagram page is usmle.derma/2/IM, like derma to IM. That's how my journey was. Thank you so much, everyone, for coming here. I know you might be in a different country, different time zone. So, especially thank you so much for coming up. And um, I'm still here available. If you have any questions, anyone want to ask any question right now, we can. You can DM me if you want to, if you're not comfortable asking it.
And we really appreciate you took the time to join us today.
No, no, for sure, anytime. Good luck, everyone. Take care, and yeah.